Hi, I'm Jimmy Lapping, psychologist and statistician, and in this video I provide a few tips for how to integrate research into your training programs, tips that can be helpful for both designing a new program and for evaluating and revising an existing program. The approach I'm going to share is also the approach we are taking at my center, the Virtual Hospital of Valdecilla, which is an innovation center that designs and delivers training programs to professionals and residents of all specialties in healthcare. And is an approach that is helping us to create more effective programs that are more in line with what people who are interested in our kind of programs are looking for, and programs that are also more in line with what they need in their daily practice in order to contribute to the best possible healthcare. What we have been seeing in the past decade has been an exponential growth of all kinds of training programs in healthcare. Programs that may focus on professional development, patient education, informative interventions for the general public, training for politicians and policymakers, you name it. But in the end, we want to ensure that the programs we develop and deliver meet participants' needs and make a difference in the healthcare system. And this is where the integration of a research component aimed at innovation in healthcare training comes in. Basically, instead of just creating a program on the opinions of a few experts in the field and taking into account legal requirements and literature in the field, it is also important to take into account the healthcare context in which our participants are working, what needs they have in their to do their jobs and as well as possible, and how we can assist them in that purpose. Likewise, once we have delivered a program, it is important to collect in a well-designed manner information that helps to document what participants take away from our programs, which things they are likely going to use in their practice, and if you have the chance, even study how they do that. Now, you may wonder, yeah, but just asking a few people who may be interested in the kind of program you're offering, or even participants that have already taken your program, that is surely not representative of the entire population of professionals or whatever stakeholders out there. You would be right in thinking that. And the purpose of this study, of this kind of study, is not to generalize to the whole population or universe of all possible people who could ever participate in a program like ours anywhere on the planet. Each center is socially accountable to the needs of the local community and healthcare system and serves stakeholders from the local community and perhaps also to some extent stakeholders from similar communities. For example, my center, the Virtual Hospital Valdecilla, designs and delivers training programs for professionals and residents of all specialties in healthcare in all of Spain, as well as in Latin America. But of course, there are also many centers that design and deliver training programs exclusively for professionals or types of participants in their geographical area, and that is perfectly fine. Now, in that population that you and your center are trying to serve, not everyone will be interested in your type of program. Be it a lack of time, a lack of specific interest in that very particular program you are delivering or going to design, whichever is the reason, you are not going to find everyone in that population interested in your kind of program. And when we design a program or revise an existing program, above all, we want to have input from that part of the population where there is an interest in our program or in the type of programs we are offering. The other part of the population who are not yet interested may at some point develop an interest in our program once they see what difference your program has made in their colleagues who took it. But for now, in the face of getting input in order to design a program that suits the needs of that part of the population that is already interested, we do not need that grey part of the population in our study, and hence will not seek to generalize the findings from our study that includes the yellow part also to the grey part of the population. Next level, once you have delivered at least one edition of your program, if you have prepared a well-designed structure to collect data from your participants, you have a rich source of information that you can use to evaluate your program and adapt where needed. or perhaps given the resources that are needed to make adjustments, and to some extent also the fact that different cohorts of participants can share somewhat different experiences, you decide to wait until a few editions have passed. Uh, More on this specific point in a couple of minutes. Now, the good thing about this kind of data is that, contrary to what at least most of us have been taught in college, you may not need a large sample of participants in your study in order to have meaningful data. Here, for example, I share the title of an open access article that was published in 2020 on the topic of thematic saturation in qualitative research, which is the idea that given common themes in a population of interest and therefore at least partial overlap between individual participants and teams of participants in this population, even with fewer than 10 participants, you may often capture over 90% of the themes from that population. And if it is a fairly homogeneous population in terms of these themes, with as few as 6 participants, you may capture about 80% already of the themes from that population. For example, if you are thinking of developing a training program for simulation instructors in healthcare, whether you organize individual interviews with instructors or focus groups with instructors from the population you're seeking to serve, you will probably find that there is an awful lot of common struggles and needs among these instructors. And you may capture about 80% of these common struggles and needs around which you can build your program with about 6 or 7 participants, instructors. So then next, once you collect data from participants who have taken the program, so yeah, instructors or future instructors who have taken the program, that may give you an accurate idea of what your participants take away from your program and provides not a perfect generalization to all other participants who could have been in your program but will likely have some informative value for those other potential participants as well. Along these lines, you may also see that when you organize several editions of the same program, there is a fair amount of overlap in experiences and outcomes between editions, and you may reach a kind of saturation of topics even more easily. To some extent, different editions from the same program can be considered replication studies, albeit not with random samples, but with cohorts of participants that have certain experiences, interests, and needs in common. To what extent we actually replicate the findings from earlier editions is, of course, a function of the degree of differences between the groups of participants from different editions. But either way, we should distinguish between replicating a study and replicating findings. These are two different things. Although sometimes we read an article which provides a very nice replication study of a previously published study, and yet in the article it is classified as a failed replication just because the findings were different, well, with different groups of participants, you may to some extent get different findings anyway. But to study the replicability of findings across studies, we need replication studies to begin with. The study itself may have been a very good replication, regardless of the extent to which the findings from that earlier study are encountered again. Now, you may think something like, well, but what people take away from a program is at least in large part qualitative data, right? And how can we ever do replication in qualitative research? And indeed, there is some belief in some areas that replication in qualitative research is impossible. Yet there are examples of successful replication studies and even successful replication of main findings in qualitative research as well. And here I provide an example from a study centered around the question, what's the headline on your mind right now, which was carried out by professionals at the Center for Medical Simulation, Boston, US, and published in 2018. And then a conceptual replication study which we performed on a different program in Spanish instead of in English and delivered online instead of on site, published earlier this year, so about 5 years after the original study. It is a conceptual and not a direct replication because apart from the differences just mentioned, the question that was asked after each immersive day in the program was also different. Yet, although different participants within each program took away somewhat different things, both studies lead to the same five core themes of what participants take away: notes to self, emotions in the learning process, evaluations of sessions and tools, anticipations of future applications, and metacognitions of one's own learning process. I'm not going to delve into more detail of these themes, as both articles are available open access now, but it is interesting to see that these different themes show up in different settings and hopefully can also be of help to develop and evaluate other programs. And finally, if you are in a position where you can actually document key data, qualitative, quantitative, or both, of participants in one or more editions of one of your programs in a period before and after they participate in your program, you may also be able to document differences in specific key performance indicators prior and post training program. Again, this is an approach that we are currently using at our center, the Virtual Hospital of Valdecilla, and we are finding it useful for both developing a new program and evaluating and adapting an existing program. I hope this is also of help to you, and if you have any questions or ideas or suggestions that you would like to share, just leave a comment here or contact me using the email address shared below this video. Thank you for listening, have a great day, and see you soon.